Tuberculosis is a disease caused by Mycobacterium tuberculosis, and it is estimated that about a third of the world's population is infected with tuberculosis. It's transmitted from person to person by respiratory droplets. Things like coughing, sneezing, or talking by an infected individual creates respiratory droplets in the air, and that can be inhaled by an unaffected person. Once inhaled, the droplets pass down the bronchial tree in the lungs all the way to the alveoli, where the tubercle bacilli are phagocytosed by alveolar macrophages and multiply intracellularly. After about 3 to 4 weeks, the immune system responds with a cell-mediated response against the bacilli. A large influx of macrophages leads to the formation of tubercles, or granulomas. The granulomas have a central core containing the TB bacilli and enlarged macrophages, and is covered with an outer wall made up of fibroblasts, lymphocytes, and neutrophils. The centers of the granuloma break down into necrotic lesions that heal by calcification and become a dormant lesion. This happens in about 90% of people infected with TB. The other 10% of people infected with TB develop clinical cases of TB, which causes destruction of lung tissue and can spread throughout the lungs and even to other organs in the body. If left untreated, it can cause death. Factors that can contribute to the development of clinical TB are inadequate nutrition, weakened immune system, poor access to medical care, lung damage, and genetics. Reinfection can occur if a person inhales more respiratory droplets or if the dormant lesion becomes reactivated. Reactivation can occur weeks, months, or even years later. The tubercles filled with masses of bacilli expand and drain into the bronchial tubes and upper respiratory tract. The patient gradually experiences more severe symptoms such as coughing, bloody sputum, low-grade fever, anorexia and weight loss, extreme fatigue, night sweats, and chest pain. Clinical diagnosis of tuberculosis involves the use of several different methods, including tuberculin testing, chest x-rays, direct identification of acid-fast bacilli in sputum, or cultural isolation and identification. The tuberculin test, called the Mantoux test, involves injection of a purified form of M. tuberculosis intradermally into the forearm. After 48 to 72 hours, the site of injection is observed for an induration, which is a raised area. Depending on the diameter of the induration determines if the patient is infected with the bacilli. If the induration is 5 millimeters, the test will be considered positive if the person has had close contact with actively infected TB patients or is immunosuppressed. If the induration is 10 millimeters, the test is considered positive when the person lives or works in high-risk residencies, is a new immigrant, or a child that has had close contact with adults that are at high risk of developing the disease. If a person does not fit these criteria, the induration must be bigger than 15 millimeters to have a positive skin test. A positive reaction is fairly reliable evidence of infection, but both false positives and negatives can happen, so another method should also be used. Chest x-rays can be used to reveal abnormal patches on the lungs. The appearance and location of these patches can indicate TB, but is not used to diagnose TB on its own. Acid-fast staining of sputum can also be used to detect Mycobacterium, but the most accurate method to diagnose Mycobacterium tuberculosis is using a pure culture to isolate and identify the bacteria, but this is usually not done by most clinical laboratories because of the specialized expertise and technology required. Treatment of TB involves administering drugs for a sufficient period of time, usually 6 to 24 months, to kill bacilli in lungs, organs, and macrophages. Most anti-TB therapy includes a combination of at least 2 drugs, since drug resistance has become a problem. It's important to treat people with active TB, but it's just as important to treat those in early stages of infection or at high risk of becoming infected to prevent infection in the first place.